Assalamualaikum and a very good morning to all the audience. Before we start our seminar for today, I will introduce myself and our beautiful panels. So, my name is KARTIQAH BINTI SUDIR as your moderator for today. Hello to all the panels, hope you guys are doing well. So, without wasting the time, let us begin our seminar entitled Managing Human Resource, especially in health sector during COVID-19 pandemic. So, let's move to the first question. The first question is, what is the impact of COVID-19 on managing human resources in the health sector? Maybe panel Izzati and panel SHAHIRAH can elaborate on the impact on all of us.
Thank you for letting me in this program. So I'm NURUL Izzati Farhana, or can call me Farhana, as your first panel for this program today. So according to the question from the moderator, what can I say is the COVID-19 pandemic has wreaked havoc on healthcare system that are under-resourced, decentralized and largely uncontrolled. So it merely adds to the strain on human resource for health. So we have investigated the pandemic effect of COVID-19 on the health workforce and extrapolate learning analytically to identify essential components need to be addressed in human resource health policy. So based on this effect, many significant areas that may be harnessed are improved to strengthen the resilience among the health workforce have been identified. So, for the system level factor, include developing health, workforce resilience policy, planning and funding for emergency preparedness, stakeholder engagement, and incentive mechanism. Organization level factor include identifying human resource health branch strength, mobilizing the health workforce, psychosocial support and disease protection, and also individual level include measures around self-care by health workers. That's my opinions and my answer for the question from the moderator, Anisafika.
Hi, my name is SYAAMIMI binti HASSAN. I am for panel 4. Okay, the question 1, the COVID-19 outbreak has had an impact on the industry, particularly on personnel who were forced to be part of to prevent wasting human resource. Furthermore, human resource management in the health sector has the impact of requiring staff to migrate to near locations. In the health sector, work patterns can have an impact on human resource management.
Thank you, Ms. Izzati and Ms. SHAHIRAH. It is such a good information. So, my next question is for Ms. SHAHIRAH and Ms. IFFAH. The question is, what is the initiative that government take to handle the COVID-19 pandemic in the health sector?
Thank you for our moderator. Let me explain about the initiative that government can take to handle COVID-19 pandemic in health sector. The initiative that government can take is rearrange the work schedule for the frontliners so they have time to relax and spend time with their families. For example, making turns or shift properly and fairly. Secondly, government should take action with hiring new employees if there is a shortage of manpower so as not to burden them. If many employees that government take, their job become easier and they get enough rest. Lastly, government have to provide an adequate range of facilities to employees to ensure their comfort. For example, providing pantry rooms, restrooms and prayer places, as well as other facilities. That's all from me.
Thank you, moderator. Let me start to explain about what are the government initiatives to assist the health sector in tackling COVID-19. First, improving pre-hospital care. The government will focus on improving pre-hospital care, including COVID-19, as well as service ambulance, to provide better treatment as well as reducing the number of COVID-19 patient admission to the ward. Ambulance service will be added to shorten response time by increasing personnel efficiency and increase the number of ambulance. Next, building and upgrading healthcare facilities. The government will improve access to quality care, especially for COVID-19, by building more clinics and hospitals in underserved urban and rural areas. In this case, more primary health care facilities and services will be provided, such as Healthy Clinic, One Malaysia Clinic, Mobile Clinic, Mobile Health Teams and Air Doctor Service. The development of new facilities will take into account the functionality and health needs of local residents. In addition, the government will strengthen the role of NGO as agent of change to promote healthy living free from COVID-19 illness. NGO will provide swab tests. NGO will also be encouraged to work with the private sector in implementing corporate social responsibility program related to COVID-19 illness. Lastly, the government will focus on upgrading care and health facility to existing COVID-19 patient asset to ensure the continued and reliability of delivery service. Absolute healthcare facility and assets such as quarters, medical equipment and ambulance will be replaced in stage. Selected non-specialist district hospital will be upgraded to specialist hospital. Apart from that, the village clinic as well as the mother and child health clinic will be upgraded to be primary health clinic, while the One Malaysia clinic will be run by doctor. That's all for me. I will pass it to our moderator.
I see. Thank you, Ms. Shahirah and Ms. IFFAH. Hopefully, the initiative can help all the frontliner in Malaysia. So, let's move to the next question. My next question is, how HR managers in health sector facing new challenge during COVID-19?
Thank you, moderator. Let me start to explain about how do human resources manager in the health sector new challenges during COVID-19. Comply with SOP rules set by the government since the outbreak of COVID-19 on 30 March 2021. The government has set several SOP rules to ensure the safety and health of Malaysians. Practicing health measures. First, social distancing of at least 1 meter, preferably 2 meter in all stations. 2. Wear a face mask encouraged at all times, mandatory in curtain station. In addition, encourage high hygiene practice. First, wash your hand often with soap or sanitizer. Second, provide these facilities to employers and customers. Third, ensure that the cleaning, sanitizing of the premise is done at a regular and consistent rate, at least 2 times a day. Practicing infection prevention practice. First, ensure that there is a protocol for illness monitoring and infection prevention. Second, all employees are checked daily for symptoms of COVID-19, including body temperature examination. With this, society can avoid COVID-19. Next, improving the health system by providing vaccine to all communities in phases. The COVID-19 vaccine is a vaccine that will be used to treat illness COVID-19. The vaccine contains or will produce an antigen for COVID-19 that will stimulate the body's immune system to form immunity to COVID-19 illness. The vaccination process once obtained will be done in states with priority given to high-risk group who are susceptible to COVID-19 infection. These high-risk group include frontline workers, the elderly and patients with non-communicable illness such as diabetes and so on. Vaccines that have passed are usually safe to take and effect in protecting against COVID-19 illness. The effect of not taking the vaccine is that people are more likely to get COVID-19 and some will lose their life. Lastly, improving technology in terms of healthy. MySejahtera also works to help the Ministry of Healthy Malaysia get internal information to take fast and effective action. The use of MySejahtera should be extended to the whole country to make it easier for the MOH to monitor the movement of the public. especially in the event of any symptom of this epidemic. That's all for me.
So for this question, how can I say that the present human resource managers issues of COVID-19 include to mention a few: arranging for workers to work remotely, supporting employee, mental health and well-being, and inspiring engaging employees. So, furthermore, rather of laying off workers or lowering pay, businesses are searching for alternate corporate tactics such as employing technology to facilitate work from home or cutting costs to stretch the budget. So, human resource manager inside the firm has also been encouraged to provide more affordable and flexible benefit package, which the government may be able to assist with. So, human resource managers, or we can call it as HRM, is facing all these problems by being the best leader in motivate and support employees, in provide direction, boost their confidence and resilience. So, employees rely to leaders for confidence, particularly during time of uncertainty. So, leader must communicate effectively with managers and employees, as well as exhibit a strong commitment to employee wellness and corporate employees are receiving contradictory projections and guidance from local, state and national governments. So, in the contextualized World Health Organization, or we call WHO, and Centers of Disease Control and Prevention, or we call it as CDC, update with detailed instruction on how the firm will implement suggestion and move forward. So, the magnitude of the disruption is one of the most significant human resource concerns that firms face during COVID. That employee will require flexibility and understanding as they strive to re-establish a work-life balance with schools and non-essential company closing or relocating online. So companies might help quarantine or self-isolate employees by increasing paid time off policy or allowing them to work remotely. So, can we say the COVID-19 has already compelled several big corporations to strengthen their employee benefit package? For example, what can I say is the reaction to the epidemic, Walmart and Apple and also McDonald's all changed their leave policy to maintain employees' safety and well-being by teaching them about transmission risks, provide training, development to set hygiene rules such as washing hands with soap and water for 20 seconds. This is for the example. So aside from that, develop social distance norms and procedures and publicly display the poster exhibiting respiratory etiquette and hand hygiene. So the following step is to do routine environmental cleaning and disinfection, as well as to supply no-touch receptacles and hand sanitizer. So as a result, one of the most important in human resource manager that concern that manager must address is how they will handle if absenteeism, the surge due to an epidemic in the workers, or if employees must care for family members and develop a care plan of action. So I think that's all my answer for your question, Miss Moderator. I will pass it to you.
What a great sharing from our panel. Without wasting the time, I will proceed to the last question. My last question is, when the COVID-19 hit, health officials had to work overtime. Whether overtime will affect the health sector?
Thank you for our moderator. As we know, frontliner in health sector had to work overtime to deal with the COVID-19 pandemic that had spread all over Malaysia. Some staff had to work several days without a break, so this will definitely affect their mental and physical health. For example, there have been incidents of some frontliners being killed while on duty, possibly as a result of the stress they face. In addition, they also spend more time at work than at home, so they do not have time to spend with their families. That's all from me.
Yes, the COVID-19 pandemic that struck the country affected people's emotions, especially frontline employees who had to sacrifice and work extra hours to save and ensure that those infected with COVID-19 could be safe. Furthermore, in order to avoid COVID-19 transmission in the workplace, the patient must give advising service and up to the information on the virus. The next step is to communicate with one another in order to help channel proper information.
Thank you for answering all the questions concisely. Hopefully, today's seminar will give all of us benefit. Thanks again to our panels and the audience who volunteered to be with us today. I apologize if there is any shortcoming on our part. Hope to see you guys again. Bye-bye.